tuned in to the Andrew Lawton Show.
I can't remember if I mentioned it on the show before or if it was in another interview, but I was at a social gathering in some way, and I was talking to someone that was very not conservative, didn't like Danielle Smith, did not like Pierre Poilievre, did not like the conservatives on anything. And I was like, oh, this is going to be a terribly painful dinner. And then the person volunteered, although I will say about Danielle Smith, I love what she's doing on drugs, because they realize that drugs are ravaging their communities. And you have so many people in quote unquote officialdom who are doing nothing but furthering this problem. And the news that has come out, including in London from the London police, the diversion is happening, is really just reaffirming what people paying close attention to this that aren't bound to their ideological support for these programs have known for a while. And one of those is Adam Zivo, who again was probably the least surprised by the London police announcement, because he was reporting on it before. I don't even know if it's cool now, but he was certainly reporting on it before anyone in officialdom was acknowledging the problem. He joins us on the line now, columnist for the National Post and founder and director for the Center for Responsible Drug Policies. Adam, always good to talk to you. Thanks for coming back on here. I don't know if you saw those two clips I played from Pierre Poilievre, but the one in particular I found interesting was he put aim on the media here and said the media has to stop elevating this certain class of quote unquote experts, while really ignoring that these people are so heavily invested in the status quo. I was wondering what your thought on that was.
Well, I think that's a very fair criticism. We have to I think it's pretty obvious that many journalists within Canada are not doing their job responsibly when it comes to addiction policy. So they only consult with a very small number of quote unquote experts who often don't even have a background in addiction medicine. Oftentimes they're public health experts who come from a different educational background, which is much less rigorous than addiction medicine. And they don't have a lot of clinical experience treating people who are struggling with addiction. And so this small group of ideologically minded activist scholars are cited again and again and again in most Canadian media, while addiction physicians who are actually on the ground are largely ignored. On top of that, many journalists don't really analyze their data really carefully. So what happens is that you often have them citing studies which are very low quality, and the journalists will just go and parrot the conclusion of the study, but they'll pay zero attention to the methodology. There's a great study that came out in January in the British Medical Journal that actually showed that safer supply didn't work, but that the data was reframed to imply that it did work. And there was a lot of missed media management there, which was an excellent case study of this. I'd love to talk about that later if we have the time.
Yeah, and I would say in general, there's a shortcoming in a lot of science and health journalism in that you have people that are not science and health experts. And again, one of the things that's great about journalism is that you can develop a proficiency and a knowledge of something without having gone to 12 years of school. But it means in a lot of ways you're beholden to the data you take in. And if you're getting in bad data or bad insights, or you're getting expert opinions that themselves are co-opted in some way or very heavily biased, the output is going to be that way as well. And the reporter may not even know that.
Well, that's the thing. And then the problem here is that also many journalists don't have enough time or resources to properly evaluate the studies that are presented to them. So I'm going to use the BMJ article that I mentioned earlier as a case study. So that study followed around 4,800 drug users in British Columbia over 18 months. And they claimed that safer supply patients had a 55 to 91% reduction in mortality the week after accessing safer supply. So they claimed that safer supply was remarkably effective at saving lives. But then I contacted 7 physicians and a statistician, and we spent about 3 weeks analyzing this study, and we realized that it was junk science, that the underlying data actually showed no statistically significant reduction in mortality, but that the researchers had relied on 1 week outcomes instead of 1 year outcomes, and it failed to fully filter out confounding variables to inflate the positive effects of safer supply. And that kind of work takes a lot of time, but many journalists, they don't want to do that. So all they'll do is just parrot what's in the conclusions, which is unfortunate. And even though my analysis has come out, many journalists just continue to cite that study uncritically, which suggests that they're not even interested in understanding the methodological flaws of harm reduction. It's concerning, the amount of laziness and willful blindness we see in this space.
I think that people like Sharon Koivu, who I know you and I, well, you were alongside her on a panel I had on the show a while ago. She's probably one of the most effective commentators because she does not have skin in the game in any other sense than she is a healthcare practitioner. And I think her testimony has always been valuable because she was a big supporter of these policies and just did what scientists and researchers are supposed to do, which is realize this isn't working, it's making problems worse, and then she's backed away. Because I do think Poilievre's criticism of experts that have skin in the game is incredibly valid. I mean, people don't realize, and I was hoping you could shine some light on this, how much money there is being made by the status quo.
Well, I mean, we have to keep in mind that safer supply is very profitable for certain doctors and certain pharmacies. If you're coming in to get your safer supply drugs every single day, then the pharmacy is charging the government a dispensing fee every single day. And I've spoken to a few physicians who have crunched the numbers, and they've discovered that one pharmacy with 100 or more safer supply patients can make $1 million to $1.5 million off of that. Right. And
off
so
of that alone. So that's nothing to do with, giving people Viagra or beta blockers or anything else. That's just on the safe supply.
Yeah. And this, of course, creates pernicious financial incentives to keep people on safer supply rather than to get them on addiction medications that stabilize them and lead them to visit pharmacies less often. For example, Sublocade is a monthly injectable quasi-vaccine, essentially, for drug use. It's essentially it's like a methadone. Well, it's like Suboxone, but then it just dissolves in your body over the course of a month. So, if you're on Sublocade, you're there for, you come to your doctor once a month, you come to your pharmacy once a month. There's much less money to be made off of you. And of course, many pharmacies are reluctant to support it because they can't profit off of it. It is concerning that some pharmaceutical interests are very invested in propagating safer supply. I know that Shoppers Drug Mart provided about $2 million, if I recall correctly, to the British Columbia Centre on Substance Use to help fund training on safer supply. So you have this big corporate interest, providing financing to an ostensibly independent research body to support safer supply that happens to be profitable for that corporation.
Yeah, and I think that when we look at this, I mean, to be honest, that should be treated with the same level of skepticism that people, should treat harm reduction research done by tobacco companies on vaping. I mean, you have to look at where this research is being funded. And I would ask you about the other side of this, which is that no one seems to be talking now in these halls of officialdom, which is the term I've been using on this episode, about getting people off of drugs. And, I remember about a decade ago when I first started to see the harm reduction discussion in London and even elsewhere ramp up, there was always that promise that, okay, and once we get people into the system, we can then look at getting them off of drugs. And I just don't hear that conversation at all taking place. And I certainly don't see any data to support that any of these mechanisms are getting people off of drugs. Do you?
No, and here's the underlying problem. So many of the policymakers and public health experts who are in control of addiction policymaking in Canada are beholden to radical drug activists who are often in active addiction. So in Vancouver, the Vancouver Area Network of Drug Users, VANDU, is highly influential and has close relationships with a number of really prominent policymakers. So if you as a policymaker are listening to people who are actively using drugs under the auspices of, listening to people with lived experience or living experience, then maybe you're not going to prioritize getting people off of drugs because the people who you are listening to are using. They want to keep on using. They conceptualize their drug use as a human right. It's interesting. I was talking to a British reporter, or rather photojournalist, who did that big piece in the Telegraph recently about Vancouver, and he was expressing shock to me because when he spoke with VANDU and when he spoke with harm reduction activists about a month or two ago, they told him that they didn't feel like there was any problem with addiction. They said it was oppressive to expect people to live fulfilling lives, or at least that's what he told me.
So how do we reorient this? Because obviously some of the proposals on the table from the Conservatives are ending funding for so-called safe supply programs. That doesn't outlaw these programs. Provinces could still step up. I mean, theoretically, community organizations could. I don't know if they will, because I think there really does need to be a government gravy train keeping this alive. But one attitude that we've seen in Alberta is really even putting forced intervention on the table. And I think we need to see a little bit more about what that would look like. And Poilievre this morning said he'd be open to that nationally, but hasn't yet committed to it. But what other resources are available to deal with this?
Well, I think on the surface level, we should be investing far more heavily into recovery. If someone wants rehab, if they want detox, that should be available to them right away, and it should be free. And it takes several tries for someone to get off of drugs, right? So, like, if it's expensive, if it takes forever, if it takes a month to get into a program, that's not going to happen. So, at the surface level, that's what needs to be fixed. But on the more foundational level, we need to think about reforms for education and reforms in our bureaucracy. Our public health bureaucracy is a cesspool of radical ideology. In Ontario, I know that public health bureaucrats are very much pushing for these radical policies against the will of the provincial government. And if you change government, that's not going to be fixed. And those policymakers are coming from schools that are once again highly ideological. So if you have graduate programs that that aren't committed to evidence-based policymaking, that think that drug prohibition is just structural racism, and then that filters into the bureaucracy, we have a problem. So it's going to take a long time to shift our underlying political, or I guess governmental understructure, which leads to these disastrous addiction policies.
Yeah, before I let you go, I wanted to ask you about that, because you had a piece in the Hub to that effect, that to Bonnie Henry, who's the chief public health czar in British Columbia, criminalizing drugs is white supremacy.
Yeah, I mean, that is the most profoundly stupid thing I've ever heard. So, look, you can argue that individual laws in certain contexts may have racist intentions or outcomes. That's fair. Laws are just a tool that we use to order society, and any tool can be abused. But they were arguing that drug prohibition in general is rooted in white supremacy. And anyone with even a cursory understanding of history, let alone the current global landscape, can see that that's ridiculous. I mean, we have Sharia law, which is banned the consumption of mind-altering substances since the 7th century. So, if Islamic scholars and lawmakers from the very beginning supported prohibition, how do you attribute that to white supremacy? China in the 19th century advocated strongly for prohibition because opium was destroying its citizens. And then, of course, the British came in and forced China to end prohibition with its warships. So by the harm reduction anti-racist framework, you can basically argue that, the British sent their anti-racist warships to decolonize China's drug policies. It's absurd. And even today, racial, minority communities tend to hate this kind of stuff. They hate drug liberalization. In Vancouver and in San Francisco, Asian communities are the ones that want change, that want prohibition. Across the world today, East Asian and Middle Eastern countries are the ones that most strongly ban drugs. And now we have some, let's be honest, upper middle class, white progressive bureaucrats saying, actually, this is racist. You should probably listen to racialized communities if you're going to claim to be an anti-racist.
Yeah, I remember when that one white protester was yelling at a guy from Hong Kong to go home at a city council meeting in, I think it was Vancouver or whatever, a couple of weeks back. But it's exactly the point here. Adam Zivo, always good to talk to you, sir. Thanks for coming on today.
Thanks for having me on again.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.